Substance use has been a part of society for centuries. Throughout history, substance use has taken on many forms, such as heroin, underage and binge drinking, tobacco, and opioids. While the main substance of use may change, our society has been confronting the problem of substance use and addiction for decades through different prevention methods. Hi, I'm Ricky Barton with Community Partnership of the Ozarks. In this help video, I'll share a brief history of substance use coinciding with the evolution of the prevention field. Substance use history in the United States is traced back to the colonial period, when alcohol played an essential role in daily life and social gatherings. Drugs such as opium and natural forms of cocaine and morphine were used for pain relief, and tobacco was a major export. During the 1800s, many historical movements took place regarding substance use, which included the first temperance movement, the second wave of the Prohibition movement, and the start of the women's Christian temperance movement. During this time, tobacco was widely used, and cocaine, opium, and morphine were common ingredients in over-the-counter items. The early 1900s started to create a road for the prevention that we know today. In 1920, the 18th Amendment passed, prohibiting sale, manufacture, or transportation of alcoholic beverages within the United States, which resulted in an increase in illegal alcohol production during the time commonly called the Prohibition. In 1933, the 18th Amendment was repealed, and the focus shifted from prohibition to regulation, and states restricted the sale of alcohol through alcohol beverage control laws. In 1914, the Harrison Act was passed, allowing taxes on opium and coca products, and allowing only licensed doctors and pharmacies to sell these drugs. Around the time of World War II, substances were increasingly misused without much oversight. Heroin and cigarette use increased significantly. Amphetamines and methamphetamines were available without prescription until 1951. The roots of substance use prevention began to appear in the 1940s, when treatment counselors were asked to speak at schools and other community events. In the 1950s, most prevention strategies involved using scare tactics. During the 1960s, drug use was popularly used by individuals to have psychedelic experiences and was associated with the counterculture or racial and ethnic minorities. By the end of this decade, drug use was considered a national epidemic. In 1964, the first report on smoking and health was issued by the U.S. Surgeon General, in response to the tobacco industry portraying smoking as a desirable form of glamour and rebellion. In response to this advertising, many different regulatory measures occurred, and lawsuits against tobacco companies increased. Scare tactics continued to be used as prevention strategies, but also started to include additional information about risk and consequences of use. Alcohol and drug misuse were recognized as major public health problems in the 1970s. The War on Drugs campaign was developed by President Nixon to reduce the illegal drug trade. Drug education was taught using factual curricula and focused on improving communication, decision-making, and self-esteem. During this time, several milestones took place, including the establishment of the National Institute of Alcohol Abuse and Alcoholism, the Comprehensive Drug Abuse Prevention Control Act, the Drug Enforcement Administration, and the National Institute of Drug Abuse. The Just Say No campaign of the 1980s was part of the War on Drugs effort. This campaign encouraged youth to resist peer pressure by saying no. Although the campaign was not effective at stopping drug misuse, it was effective at bringing national awareness to the issue of substance misuse. In 1986, the Office of Substance Abuse Prevention was established, followed by the 1988 opening of the Office of National Drug Control Policy. Partnerships developed as the public became increasingly involved in addressing the problems of substance misuse. During this time, Mothers Against Drunk Driving was formed, and in 1987, the White House Conference for a Drug-Free America recommended training and prevention for professional service providers. Prevention strategies included parent-formed organizations to combat drug misuse, social skills curricula, and refusal skills training, and parenting education. Research in the 1990s examined risk and protective factors and the link between a variety of high-risk behaviors, including alcohol and drug use. In 1992, the Environmental Protection Agency announced tobacco as a carcinogen or a cancer-causing agent, and the Occupational Safety and Health Administration banned smoking in the workplace. Also in 1992, the Substance Abuse and Mental Health Services Administration was established, bringing funding for community collaboration to address alcohol and drug problems. Prevention strategies included community-based environmental approaches, media campaigns, culturally sensitive programs, evaluation of prevention programs, and professional training programs. As the new millennium began, the national focus turned to understanding the connection between substance use and mental health. The term behavioral health emerged, used widely to encompass both substance use and mental health issues. Prevention strategies focused on application of evidence-based models, comprehensive programs targeting many contexts, such as family, school, and community, and data-driven decision-making through a strategic planning process. Since 2010, there has been a greater emphasis on prevention and treatment for everyone. The continued strategies of using evidence-based practices and strategic planning processes have helped create what prevention is today. Understanding the history of substance use prevention can help us better understand the behavioral health policies, attitudes, and strategies that society accepts or is challenged by now. If you have any interest in getting involved in substance use prevention or learning more about the efforts that Community Partnerships assists with in communities, contact us at 417-888-2020 or visit the web address on your screen. And thanks for watching our Helping Everyone Learn Prevention video series.